job. Totally normal, natural to have 12 or 15 cameras on you while you're getting a shot in the arm, right? Good job.
Oh, we're losing something here.
So I won't touch
it. It really is. No one touch it. Okay. Everyone be still.
Very good. Okay. Thank you very much. And just before I take questions, I just want to say how pleased I am about the very important day that you're all witnessing. This is a beginning for the state of Illinois. People getting vaccinated, particularly our healthcare workers, is an exciting moment. I hope that everybody will take note that you were part of this and witnessed this. These healthcare workers have been working all throughout this pandemic, taking care of people on the front lines. These are our heroes. And our heroes now have stepped forward to get their vaccine and to show the way for everybody else. And I'm really thrilled. I'm thrilled to be a part of this moment with all of you. And I'm very excited for what's to come for the entire state of Illinois. So with that, I'm happy to take any questions from members of the media.
Senator, what kind of security was given to the vaccines that were, taken from the center up in Chicago, downstate, and everywhere else?
Mm-hmm. So the question was, what kind of security has been provided for the vaccines, for the people who are carrying the vaccines? We have made arrangements through our public safety efforts in the state, so that's the Illinois State Police, and local law enforcement to make sure that at every step of the way these vaccines are protected once they arrive in the state and to the locations that they're, the original location, of course, for the vast majority of the state was our state national stockpile, the SNS. And every step of the way I met with the state troopers that were at the SNS yesterday, and they escort these vaccines as they move from the SNS to the RHCCs, the regional hospitals that also have ultra cold storage, and then local law enforcement typically are accompanying the local health departments as they pick up the vaccines and take them to the various places that they go.
Governor Pritzker, when you announced your plan to restore Illinois, you said that we couldn't go to concerts or sports stadiums or reopen our businesses until a vaccine arrived.
That's right.
Well, I see one.
Yeah. You'd like me to open everything up? Here's the...
What does that process look like? When can people know safely they don't have to wear a mask anymore? What does that process look like over the next few months?
Yeah, so the question was phase 5 of the Restore Illinois plan that we put out months and months ago. Calls for an opening of the state, and it's in the event that there is a vaccine that's widely available or successful treatments that are widely available. And so today is the beginning of a process that allows us to move toward reopening the state entirely. It will take some time. As you know, the manufacturers of these vaccines are working as diligently as they can. The FDA working diligently to give emergency use authorization and to get us the vaccines that we need to cover the millions of people that will get vaccines in the state of Illinois. So the length of time, as you talk to the experts, what they would say is that the manufacturing process will take some time so that they can deliver them as fast as they can, but months will go by here while we are working through the ACIP CDC guideline for healthcare workers and for those in long-term care facilities, and then for the many others that are in the various phases, 1B, 1C, 2, and 3, and 4, until we get herd immunity. That's what we're all aiming for the state of Illinois and for the United States of America.
Governor, there were a couple of hospitals in the suburbs that were expecting to administer their first shots today. That's being moved
Sure. We wanted to make sure that, as occurred in the city of Chicago too, and in a number of other places, that people could see the first people who will get vaccines in the state. So that's why we're here in Peoria. The SNS is nearby, and so this made it more convenient to make sure that we could do this today. As for hospitals that aren't going to begin vaccinating until tomorrow, that's because, and you may have heard yesterday, I had the CEO of the Illinois Hospital Association, Healthcare Association, at my press conference, and the hospitals themselves, for the most part, have asked for delivery on certain days. And so we've made sure that we adhered to their requests. I know that some hospitals are anxious to get theirs. Their communications folks would like to have been the first, let's say, in their area to do it. But the hospital associations, the administrators, those who run the hospitals are the ones who ultimately determined when they would have their timeline begin for vaccinating people at their hospital.
How many do we expect to get the first dose today?
I'm sorry?
How many do we expect to get that first vaccine dose today?
I'm not sure how many will be done today. I know that, we're rolling out there, I think 43,000 initially delivered. And then, as you know, there are 4 counties that are receiving deliveries from the federal government directly. That's beyond Chicago. And that's St. Clair County, Madison County, Lake County, and Cook County. And so they'll be rolling out over the next several days the entire 85 to 86,000 vaccinations that will be available this week.
Maybe a question for Dr. Ezike, I'm not sure, but what level of protection or immunity do these folks have after that first shot? We know they need 2. And then how closely do you hope people watch this process so that we can combat the public skepticism about the vaccine statewide?
Right, well, first of all, congratulations and thank you so much for your service and for being part of this monumental day. It's very important that everyone understands that you do need both vaccines with that minimum of 21 days apart. And so they cannot consider themselves appropriately